Welcome back to the Crooked Smile podcast, brought to you by Macromedia Group. As you can see on the green screen, Gianni has broken his hand.
Look at
his
this
little pinky finger,
It's
dislocated.
a dislocation.
Sorry, my bad.
But I was very brave and I didn't cry at all when they popped it back in.
Today we have on the owners of
Aligned and Centred Acupuncture,
which is a Chinese medicine and Chinese traditional medicine clinic, which focuses on things like acupuncture,
cupping techniques,
fertility treatment.
Yeah, really interesting.
Meditation's a big one.
Meditation's a big one. But just in general wellness, holistic wellness, I guess harmony between the mind and body, and it's working on practices that have been going for
5,000
years, all throughout Chinese culture. So really, really interesting episode today. It kind of talks about how the body itself can heal. It just needs some assistance, right, from these practitioners who
it's about
work in these
unlocking
areas.
the pathways to allow your body to heal itself. So Shannon, Ethan, thanks very much for being here,
Thanks,
guys. Thanks for your time.
Thanks for having us.
So you guys have your own clinic on Chinese medicine and acupuncture.
Yeah, correct.
How does one get into that? It's a pretty niche sort of practice. How do you discover that sort of practice and decide I want that to be my own clinic?
I mean, I finished school. I didn't do the ATAR or anything. I had no interest of going to uni, but I knew I was having my own spiritual journey as well, and my mum was similar path with that, and she was studying naturopathy, which is, you guys know what naturopathy is. So that's interesting. That's the whole, it's like the witch doctors, what they call them, but there's like a natural form of healing.
Naturopath.
Yeah, naturopath, naturopathy.
gotcha.
My bad. Same, different
Yeah.
word. So she was at uni, and that's where she's like, why didn't you try acupuncture? You might enjoy it. And I listened to her. So I'm like, all right, I'll give it a go. I think I was 18, just 18. So I just jumped straight into that. And it wasn't like a normal uni. You got to do the ATAR and the prep. You can kind of just jump right in.
So how did you guys meet and decide you want to start a
That's a
Chinese
funny
acupuncture
story.
place
A
together?
cute story, yeah.
Well, we met at uni, really.
Yeah, we didn't like each other when
No.
we first met.
Okay,
Yeah.
I'm intrigued now.
Yeah, well, I mean, from my perspective, I remember he was hanging with a friend already at uni in my year, and he was there, and I remember he was just talking, and I could just see that he was hiding some stuff, and I'm like, I see you hiding stuff, and I didn't like that because I was doing the exact same thing, and so it's kind of just mirroring to me my own judgments about myself.
Yeah, pretty much, man. It was the same thing. I saw in him a confidence that I didn't have, and so for me, it was kind of maybe a bit of jealousy that this young lad, I mean, he's a bit younger than me, doesn't look it, but hey. Yeah, so I saw jealousy and confidence, and that was something I wanted and felt I didn't have, and that's what I was showing on the outside. When on the inside, I was feeling the complete opposite. So, yeah, then when we actually kind of, I guess, met in that different moment, I guess, that's when we just gelled and things just journeyed on from there.
I was going to ask that university process, like how does one then, what do you learn, what are the general things you learn, and then how do you specialize? Like where do you have to go to become a practitioner in Eastern medicine or Chinese medicine?
Yeah, I mean, so the degree is traditional Chinese medicine.
Yep.
And so it's kind of it's a 4-year degree, a bachelor of traditional Chinese medicine. So pretty much, I would say a good half of it is actually learning Western medicine stuff. So like the musculoskeletal system, biology, chemistry, kind of, and learning a bit of pharmacology.
Man, more than that, it goes into the depths of, you're doing a Bachelor of Health and Science.
Yeah.
And then, traditional Chinese medicine. So
it's like your major within the bachelor.
yeah, we're still good at, like, we're going through, the deep parts of pathology and pharmacology and stuff like that. There are contraindications to, the Eastern medicine herbs and the Western medicine pharmaceuticals. So it's a pretty intense degree to be honest. Yeah,
How long is it?
4 years. Yeah, so full time 4 years.
And so once you finish, then you can actually start working for someone or open up your own practice, as long as you're registered with APRA, which is like everywhere. So doctors, nurses, chiros, they're all registered with APRA, and then they'll have their body underneath APRA. So ours is CMBCA, like Chinese Medicine Board of something association. And then we need insurance kind of thing, but it's kind of a bit pricey to get going. Once you're going, you can just start practicing.
And then so you finish uni and then you go work for someone else first, so you decide you want to start your clinic straight away.
I mean, you can go and work for yourself, but I mean, it's not easy. There's a lot to learn. And you asked a question before about how do you specialize. I think you develop a passion as you start to sort of, for me, it was through the degree. I sort of got about maybe 2 years in and just became, I went in for neurological. That was my thing. My mum had an accident and saw the effects, how it helped her in her journey. And that's what, sort of inspired me to want to study Chinese medicine. So that was, that was what drove me to get into it. But yeah, about halfway through, I just become fascinated with women's health. And so that I found my passion in uni. So, and then coming out of that, I worked for someone else who pretty much specializes in that area. So, I spent maybe nearly 2 years working under a mentor, I say. Yeah.
So for the audience, could you give just a wide range of the services you provide? Because I know there's quite a few.
Yeah, so we do one-on-one acupuncture and in Chinese medicine. So in that involves a consultation. So similarly, you sit down with them and they'll be coming for something like maybe back pain or fertility stuff or going through IVF or headaches, stress, like all of these different things they'll come for. So we'll talk about that, how long it's been going on for, what triggers it, what helps it, what have you found. And then we'll do, because it's a holistic practice, we're not just looking at that. We're like, okay, what's causing it? What else is going on? So we ask about sleep, diet, stress. There's like women are a bit more complicated than men with the menstrual cycle and stuff. So there's a whole, so we go into that. And then based upon that, we'll get a diagnosis for them, a Chinese medicine diagnosis, and then treat with acupuncture. There could be herbs. No, sorry, we don't do herbs. Could be cupping or gua sha, a bit of massage, electroacupuncture, but it's always going to be acupuncture, and then with those other modalities as well. But we do, so that's one-on-one. We do community acupuncture, which is a bit of a, we're the only ones, are we the only ones doing it? I think so.
We were. We were. Yeah.
So that's cool. Community
You're the
acupuncture.
originals.
Yeah.
The first community acupuncture.
In Perth, it's huge around the world. So that's why we kind of got the idea. So it's just cheaper acupuncture. We have our clinic 4 beds in one big room. And so they just, every 30 minutes, someone just comes in. We treat like 2 people an hour. And so it's a bit lower price. And it's just a bit quicker, less in depth, more just needling and it doesn't negate the effects and the quality of our care, but it's just a bit quicker and less in depth. So then we do also acupuncture and meditation, which is something we really had last night.
Because I was going to ask, I guess, about Chinese medicine and the origins, and obviously they're a fascinating civilization, and there's so much that we can learn from them, and maybe some people don't want to. But yeah, so what are the origins of Chinese medicine? What's kind of the whole philosophy around it?
Matt, I think the biggest thing that stood out for me, like even now and at uni, and which is quite simple, was it's just living in harmony with, the heaven, the man, and the earth. And so, which is like a really basic concept, but it's so powerful. So, and I mean, it dates back 5,000 years. Like it's an ancient practice, But yeah, it's all about, living with nature, living with the energies, stuff like that, in harmony. So that's like the biggest, for me, that's what really stood out for me.
Do you think it's becoming more common again or less common?
Definitely more common, yeah. Like people are starting to kind of, I guess, wake up or just I guess, seeing just how effective it is, like being able to, still partner with Western medicine, but moving away from that quick fix kind of thing, and really knowing that the body knows how to heal itself. You know, Chinese, we're working with disharmony. So, yeah, it really is all about bringing the body back into balance. But we're not doing that. We're guiding the body to do that. We're just looking for the patterns of disharmony that arise. And that's what we're treating, just to get the body back. Man, it knows how to heal itself. The body knows how to heal.
Natural society, Western society is kind of going downhill. I mean, look out in the world, and it's failing people. Like the medical system's failing people, and then people kind of, like Shannon said, wake up or look around and see that it's not working for them. The mainstream is failing them. They seek alternative and like natural and ancient forms of healing, and of course, Chinese medicine would be very different to how it was 2,000 years ago. Like sometimes we use 30 needles on someone. 3,000 years ago, they would have it'd be different, the type of needles that they have, and they would be reusing them and just maybe 1 or 2 or 3 needles. But in China, it's very much integrated in their medical system. Of course, it's Chinese medicine. And so you'd go to an actual hospital and have Chinese and have acupuncture, and we've been told huge wards of just treating stroke victims with acupuncture and just having electroacupuncture every day for a couple of weeks. But here it's different because it's like a holistic thing, and people come and we put needles in and they relax and stuff. And I feel that's also helpful because Western society would just go, 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 go. And that causes a lot of suffering and disharmony in itself. So like what Shannon says, come in, put the needles in, and often just relaxing and stopping allows the body to heal.
That's really interesting, because I was going to ask, do you think more people are turning to it? Obviously, there's a spiritual side and all that, but some people are just realizing that the practices themselves, for example, as you said, just stopping for a second, even with meditation, taking that time out of your day to kind of collect your thoughts, or I don't even know, try and push bad thoughts out. The actual health benefits of it are starting to come through, rather than people are, I guess it's stigmatized, and people are, thinking about, I don't believe in all the spiritual stuff, I don't believe in that. But in practice, it's so good for you to do these things. I'm just trying to think about, even like yoga and stuff like that. People are starting to do more, not necessarily for the spiritual side of things. They might not believe in that, but in general, it's a good health practice. Yeah, I guess. I don't know if that makes any sense.
These practices are holistic, which means body, mind, and spirit. So it helps, and it's about integrating them, and so those can work together instead of being in disharmony from each other. It's like if your mental body's over there, and your separation within the self, that's what causes the disharmony.
So how many needles do you reckon you guys go through in a week?
You can't really
probably have stock takes on this sort of stuff.
It really varies. That, as I said, because we've got the community as well, that's generally quite a busy day. So yeah, we're seeing more and more, I guess, because we're a pretty new practice. Like, we've been practicing for some time, but on our own, we're starting to see, we're starting to run out. So I'd say, man, in a week, I couldn't off the top of my head, but my last order was 5,000, and then pretty quickly 2 weeks later, I was like, oh man, I need to order again, because they take time to get here. So it really depends. As Ethan was saying, ancient methods would be maybe using a couple of needles, and they used to reuse them. We don't. They get disposed of.
Yeah, that's good.
But
Nice practice to do. Healthy practice to do.
Yeah. But yeah, some clients you could be using, the method Ethan uses compared to me is a bit different. So he might use less than I do, but it really depends on what you're treating. So, and people may come for more than one issue, I guess. So, you could be someone might be coming for headaches and neck pain, but they've also got calf pain, or, or something like sciatic pain or something like that. So it just depends, man. But yeah, a few.
Where are the supply? Is it hard to get it supplied out of Australia?
In Australia, there are people here, and it's always nice to support local. But you know, we use interstate because, you know, it just works better that way.
Would you get many people that are scared of the
Oh, yeah.
needles?
Yeah.
Yeah. So what's
Kind of
the
how do you
yeah.
approach that?
How do you?
Funny story, man, because I used to disregard the tattoos. I used to faint at the thought of a needle. More or less,
So
like,
you've had quite a turnaround there.
yeah. So in the first parts of uni, man, it was a struggle because I knew I really wanted to do it. I was called to it. Like this was my journey. But yeah, it was in the first 6 months. It was a lot of
Fainting. Yeah.
No, not so much. just a lot of support from peers and just like you know, a lot of courage and exposure and stuff. So I guess that allows me to hold a space for the clients that are scared. And that
I think that's why he's a bit
hurt.
more gentle than me. Actually,
Yeah, he's a bit rough.
because
Oh, right,
Chinese,
okay.
the Chinese in China.
Yeah.
I mean, I haven't been to China. I this is just from stories I've heard from practitioners and stuff. They like that feeling because you can put the needle in and it stings a little bit sometimes as it goes through that first layer of like the what they call the nerve endings and stuff. But once it's in, it shouldn't hurt unless you're touching on a nerve, and then that you feel that and it's obvious. So we pull it out a little bit, but we call it dirty, the sensation, and so you can feel like a heaviness or an ache or a throbbing, and that's the chi in that meridian being like stimulated, and that's what we want. But in China, if they don't feel that, it's like it's not working.
It's a waste,
so boom, 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 they want it strong. But in like Japanese acupuncture, it's just really delicate. You barely feel it and gentle. And I've had some complaints that I heard them, and so I've been working on being a bit gentle because the technique I do is more. So say if you have like a neck pain, I'll put it in like your wrist because like you can treat the whole body on the arm or the leg. So sore shoulder, you can treat the knee. Sore shoulder, like frozen shoulder, treat the ankle or the wrist. So that's cool. That fascinates me. That's what I enjoy. But some of those points in the feet and the wrist is very nervy, and it's very easy to just touch the nerve. It's like it jolts.
I guess the difference is he's probably treating a lot of pain areas, and so he said he enjoys that. So I'm seeing a lot of women that are, not saying that women are vulnerable, but more so because I'm working with a lot of fertility. So there are a lot of like more sensitivity, vulnerability, working with a lot of pregnancy, seeing a lot of women in labor induction. So towards the end of pregnancy, they're, you know, quite sensitive. So, you know, I don't want to be shocking the baby, you know, I want the body to be relaxed and calm. So it's just a different way of approaching it, I guess.
And you can or can't talk about a little bit about treating people near the end of pregnancy with just relieving sort of what you do.
I think like for those who don't understand, we're talking about we're kind of restricted on just for the of what we can say just in Australia of APRA of treating specific treatments for like acupuncture can help cure this.
There is a lot of research in terms of you know, supporting through that process of labour induction, and more so in those last months, the stress on the body. I mean, my partner's nearly 37 weeks pregnant currently. Man, I'm seeing the stresses on her body. The body changes, and this little boy doesn't look so little in there. He's putting pressure on her hips. He's, you know, the hormones are changing, so you know she does get a little bit stressed a bit easier and stuff like that. So, yeah, certainly. In terms of supporting through the end stage, and as Heath talked about a bit earlier, just it's all about, it's just like the flow. So the needling is in the cupping, the massage. It's all encouraging the flow, the movement. I mean, I'd say 90% of my clients are falling asleep. So you know, you got up to 30, sometimes more pins like in you.
Does that mean you're doing a good job?
Yeah. So we have some in the meditation acupuncture snoring.
Yeah, and from a Western diagnosis, acupuncture, there's a lot of research of how come acupuncture can help reduce pain. And of like what Shannon was saying, it helps increase blood flow to different areas.
Yeah.
And like dry needling, that's huge, like chiros do that and stuff. And what that is doing is, say if you do have a sore shoulder, they will needle into the muscle, into the trigger point to help get blood flow to that area, but also it causes like good micro damage. And so it's like sending a signal to the brain and to the nervous system to go and to go to that area, help heal this area.
Okay.
So we use that as well. But we're working with the meridians also. And we know that the meridian and chi is what flows through these meridians. And when that's out of balance, when that's out of whack, when that's stagnant, you're going to feel it, and it's going to manifest as pain, as different symptoms. So like the chi is almost like the messenger of the body as well. It works closely with the meridian, with the nervous system, and closely with the blood, the vascular system. So yeah, needling those helps. We support the chi, we help undam, unblock stagnation, but also get blood flow, help, the brain and like with stroke. That's an interesting one.
And nervous system, yeah.
Yeah, people, Bell's palsy, when their face in China, they would go and have acupuncture every day to perhaps help with that.
Man, I've got a nephew who had Bell's palsy at 15. So he had some pretty good results from treatment. So,
Well, you mentioned cupping before, and I'm actually quite interested about the cupping because you see on
You do see
TV
the Olympics,
at the
yeah.
Olympics, all the swimmers and stuff have it down their
Crazy.
backs, and even AFL players now get them. So, kind of what is cupping and what are the benefits from it?
man,
Cupping's good.
do you know anything about cupping? Like,
I have
you
no idea.
You've just seen the marks.
I mean, I'm just thinking from an athletic point of view.
Pretty much what it is, so they're glass cups. All right, so as anciently they wouldn't be using glass; they'd be using non-sterile things, anything that they could use, pretty much
Wood.
to cause suction. Yeah, wood.
Hooves, horse
Splinters
hooves,
all down there.
Yeah.
I think.
So they're like a glass cup of all different sizes, pretty much. So they can be sterilized, cleaned. But what we're using is a flame, and so that flame goes into the cup, which pushes out the oxygen, and so then when it goes to the skin, it causes that drawing up, like so it draws the. So it's, I guess, from a physiological point, it's like it's drawing the muscle away from, like, not directly away, but away from the structures, which is, so it's allowing an influx of oxygenated blood to come rushing to that area, and it's drawing out the old. So if you could, in a simple way, so yeah, it's like
Helps
drawing,
circulate blood flow.
yeah, so it's a blood flow. So drawing out, the muscles are really, really tight, over time, overuse, injury, all of that sort of stuff, they get tight, limited blood flow to the area. It's like Meath was saying, then we start to manifest, chi gets blocked, blood gets blocked, and it's that messenger stagnates, sends a message of pain. Yeah, so that's the cupping's like drawing the old out and just an influx of the new in. And so that's the mechanics of how it works.
Okay.
Yeah.
So
Yeah, and how I explain it with the people who haven't had it, so if you guys were laying in the bed, I would explain, depending what you're using it for, like massage, right? You're pushing in, like you in remedial massage, you're putting pressure into the body and helping release that way. Whereas cupping does the opposite; it sucks. It pulls outwards, so it pulls your blood, your skin comes up, and your muscle, your fat, your fascia, all of that stuff. So it pulls, it squeezes out, and you take it off, and then it can release. So I've heard it helps break up muscle memory, unwanted muscle memory, which is knots. So you get knots through working out when you use your body.
Yep.
You tear, and then it grows back, but sometimes it grows back, a bit of knot or a bit of tightness. So we put those cups on, we help break apart that and then release it. And then you'll see, depends, like the purple marks, real stagnation. Pink marks, that's fine. So, but they're not bruises. People think they're bruises.
Because how long do they last for?
oh man, it depends on me. They tend to last like 10 plus days. But man, I kite surf a lot, so I'm using the upper parts of my body, so they're tight.
Yeah. Okay.
So yeah, and neck pain. So mine come up pretty strong, but yeah, they're not a bruise. They don't hurt, stuff like that. But then some people just a mild stagnation, maybe a couple of days. So
And how often can you do them? Like all the time, or you have to wait for the mark to go away before you do it again?
It's usually a good idea to do that, to wait until that mark goes.
But it's still kind of doing its process over that time. You're not just doing the cupping and then see you later, the process has stopped. It's still doing the work. Like as Ethan said with the needling, it's like a micro injury. So the body's going to send a message to repair that. So similar sort of sense.
Right.
That work doesn't stop once you take the cups away. So yeah, you want to give the body time to repair also.
So if an athlete's cupping, they've got this kind of like, it's a bit of a trick to get this fresh blood pumping and kind of, I don't know, is that where they do? Because I just remember this crazy image of swimmers, they take off their tops and they've just got 5 or 6 across their back
Like an
or across their
octopus's.
chest. Yeah, it's just
Yeah.
like, I guess people would look at it just from the outside looking in and go, what the hell? Like this is some sort of, but it's using the body, like it's using the body's own substance, right? Like it's no doping or anything. There's nothing weird being injected. It's just,
As we were saying before, man, the body knows how to heal itself.
Yeah.
Man, you think about the injuries we do to ourselves and how we repair. Like you break a bone and the body knows how to repair itself. So.
We don't know how to repair that. Hey, it's like
Yeah.
when you cut and it scabs. I don't know how my body's doing that. I'm not
Yeah,
directing it.
yeah.
Your body has an innate
ability,
an intelligence. It has an intelligence to it. So that's what Chinese medicine and all of these holistic practices are kind of working with the body.
What's the performance enhancement element?
Pain is stagnation. If you have pain in your body, often it's stagnation and something, the blood or the qi is being, and the muscle is constricted and tight. So again, putting the cupping on helps open up. And that's a good analogy for just life in general. Like if we're open and surrendered, and that's meditation. You open up and you just allow and you feel and you surrender and you allow life to flow through you and you can function properly. But if you're just constricted in your mind and your energy is all tight and you're anxious, you're not going to really operate properly. And so it's the same with that performance enhancement as well, as you can make that kind of state as well. Doing those relaxing practices can help calm your mind to help then enhance your performance enhancement kind of as well. But the swimmer put the cups on, help get rid of the pain so then they can swim better without any pain.
So increasing movement, really. Like, man, you think if you can't get out of bed or your back's sore or whatever, you're going to restrict your ability. So,
Well, how high can you cup? Can you cup like right at the top of your neck? Or
where there's hair, it's a bit hard. But,
Yeah.
you know, man,
pull out the
I mean,
hair.
on the legs, it's not so bad and stuff. But, yeah, through the hairline. But, yeah, I mean, you can cup everywhere on the
Cup
body.
the face.
you do
Man,
one on the
yeah,
forehead?
yeah, I've got a mate who's bald enough, giving him a bit of a cup, but man, literally anywhere you can cup, the bottom of the heels, stuff like that. Anywhere where you can get a cup to stick, absolutely, man. I've got quite a few footy players that come in and get a lot of calf pain, tension, tightness, hammies, stuff like that. And yeah, cupping's just a godsend for them. So it's depending on how part they train. Some of them are in for treatment, once a week during their training sessions after a game. So
I guess what you guys have been talking about so far is all kind of can be put into this, but I wanted to talk a bit about, because I read on your website about energy imbalances and treating energy imbalances.
Our name, for anyone who doesn't know, is Aligned and Centred Acupuncture. And that name has a lot of meaning for us. It's kind of a state of being that we try to hold to be aligned and centered. And so when those are properly, correctly aligned and centered, then energy flows so that, like I was just saying just before, energy can flow and it can flow naturally because energy doesn't want to be held onto. It just wants to flow naturally. And everything is energy, even if like the wall over there, it's just a really dense vibration of energy, but our thoughts are energy. It's just mental matter. Emotions is energy in motion. That's what emotions mean. And so when you're aligned and centered, and that's the huge part of the meditations that we facilitate. I love this part as well. So I love treating pain, but also helping with this stuff because it's what works for me. And I've had so much success with meditation and working with my own energy blockages and different things like that. So yeah, in our meditations, we guide and share how it feels to be aligned and centered. So grounding into the planet, aligning, bringing all your bodies kind of in harmony and just allowing it to flow and then being centered in the heart. And we talk heaps about if you're judging something, just judging a person, judging your thoughts, judging your feelings, judging a situation, you're creating stagnation, you're creating energy blockage just by judging something because it's not allowed to flow freely. And so there's a whole different type of kind of philosophy of healing is that, and all pain, all disharmony, all disease mentally, emotionally, physically, is caused by caused by judgment, because judgment stops energy flowing in its track. And so if you just simply, I stop judging, I release a judgment, I just release, and it just allows that energy to kind of just to flow. So that's the holistic, not the right word, holistic, but that's another a way of looking at that energy imbalances. But with acupuncture as well, it's doing that as well.
So if someone presents to you with an energy imbalance, obviously they've got that sort of thing. What else can you be seeing just in general? Stress, tiredness?
Stress is a huge factor.
Yep.
Whether it's mental stress or physical stress, we overwork our bodies. We do too much. We don't sleep enough. You know, that's a common thing that we see. So
Eat shitty food as well.
Yeah.
Dietary. I mean, we look at all of those sorts of things as well. But yeah, like as Eth was talking, yeah, definitely, you know, energetically, mentally, all of that sort of stuff. But physiologically, man, we do too much, and we don't take time to just stop.
Yeah, and not taking time to actually stop. Like if you're working, I know I have a client who just works, owns like an accountant business, and so she has trouble sleeping because the only time she actually stops is when she's trying to go to sleep. So I'm like, look, mate, if you're going all day, you're physically going, you're mentally going, you're not allowing to stop. So then, like I said, the only time you do stop is when you're trying to go to sleep. But you all day you've just been training everything to just keep going and going. So that's why your thoughts are just racing when you're trying to go to sleep. So I'm like, look, practice just for 2 minutes or 5 minutes every hour, or just stopping and just being receptive and just feeling. And like I reckon relaxation is the most underrated spiritual practice. It's so like in general whole body relaxing your mind, relaxing your body, and just allowing stuff to feel. And then you'll just, I'm judging this, I'm judging that, I have preferences, anxieties. That's all like just judgment. So it's like, okay, let go, allow. That for me works, might not for others, but it has. When we talk about this stuff, it works.
Yeah, because it's interesting because we've had a bit of a theme with the past few episodes of wellness and kind of the mental versus physical aspects of wellness. And what's your guys' opinion on the importance of them? Like, is it both hand in hand or one or the other?
Mind, body. You think your mind's not good, your body's not good, your body's not good, your mind's not good. They work in synchronicity. Like, if you've got a stagnant mind, people are less likely to want to start moving, stuff like that. Or our bodies are tight, bodies are stagnated and all, not in a good position. It affects the mind, man. We know how. I'm not sure if in yourself, but I've had injuries that have stopped me from surfing. And my mental health suffers. And then that causes, and then I start eating badly, and then and then I'm not sleeping properly. So it has this catalyst effect. So, man, I practice more qigong sort of style of stuff. I mean, that helps with my body stuff. I find it a bit more difficult to sit and meditate. I still meditate every day, but I'm more of I find for me moving meditation works better because it helps my mind-body connect.
So what is qigong?
Qigong. Like Tai Chi. Have you heard of Tai Chi? No, man.
He's a Chinese medicine.
We are the audience. We're the novices.
So, man, Tai Chi, Qigong, they're very ancient practices of Chinese medicine. And they very much are, like one of the foundational parts of Chinese medicine you were saying earlier. So it's based on a show, I think it's like the Shaolin martial arts, so which was a faster movement. But man, it's really about being fully present with the body and mind. They're slower movements. I mean, I can stand here and show you, but it's a bit hard. But yeah, I mean, a lot of people have heard it, but
so it's moving meditation.
Yeah, it's like moving meditation. Yeah, but you're really still connecting in with the meridians, which is what we're treating with through acupuncture. So, but and you really are fully present with the body when you're moving. They're slower movements, very purposeful movements, very grounded movements. Same as Eth was talking earlier about being, and I said earlier too, about being, really in harmony with you know, with the earth, man, like everything comes from there, but then also that heavenly energy. So that's the yin and the yang. So yeah, so there's that body and mind. Absolutely.
Interesting.
Yeah. And your thoughts create your reality as well. There's that saying, which is true. And
Manifesting.
yeah, you manifest what if you're feeling shitty about yourself, you'll feel that you're a shitty person. But if you like, that's why affirmations are good. But to feel affirmations, and they will create, you know, it will manifest as well. To really feel what you're thinking about. And
I really feel personally that like acupuncture, all of those holistic medicines are completely like underestimated. Like, man, that's
There's a stigma around it.
yeah. That I mean, yeah, okay, the fear of needles, but we see so many people, like daily, weekly, monthly, and from all different walks of life and stuff like that. But being able to be a part of their journey, whether it will be for, you know, through their fertility journey, their pain journey, their mental health journey, their just anything, but being a part of their journey and seeing them walk in or not being able to walk in because they're in pain, but then seeing that evolve and seeing that change over the course of time, man, it's a pretty beautiful thing to be a part of. So that's what drives me to keep doing it. Man, I've been a kite surf instructor, a barber and whatever, and, you know, been doing this for some time now, and man, I love it. Yeah, so I think it's really underestimated.
I think I really like the concept that the body does heal itself, and you guys are almost just helping that happen, because most people just block that from happening with, you know, their daily life, Western practice, whatever. That's really quite interesting.
Man, and there's so many quick fixes. Like we could take a pill and yeah, that'd get rid of your headache.
But that's the symptoms, not the causes you guys
Yeah,
have
like
talked
the
about.
root cause. Let's get to what's causing. Where's this headache coming from? Like,
It's almost similar. It almost ties in with chiro, like a
Yeah.
bit what Pat was talking about, because Pat was also talking about like whole Dr. Pat Pugliese, of course,
Yes.
for a few weeks ago. He was talking about almost how he was like a life coach for some of these people that come in, they're stressed, they're freaked out. And he doesn't just say, you know, I'm going to do this and then you're going to leave. He talks about, he asks them why, like kind of tries
He
to
really
get down to the
addresses
root
finding the
cause.
root
Yeah.
I work a lot with Pat and swap treatments. He treats me, I treat him.
Yeah,
like
yeah,
that.
yeah.
But that was me walking into his practice 10 years ago. Like, I just had this pain and I just wanted it gone and I just wanted one treatment. You know, GP was just high meds, like here, take this strong medicine, go away. But over the, you know, Pat supported me. That's what I love about him, man. And why I recommend people to him, because he's not just a quick fix kind of guy. He takes the time, he will sit with you, and that's what we're trying to embody. Well, what we do embody as well. So, yeah, absolutely.
So where can the audience find your practice?
aligned in Centred Acupuncture in Alexander Heights.
I have to say, man, we've got a pretty amazing clinic. So it's in a home, like the whole house is a clinic, but we get a lot of comments that it feels homely. You know, it feels like a community kind of thing. Like it's a really beautiful space. So
His partner was living there, and she's a massage therapist as well. So we have her business, which is Gaia Wellness, working out of the same space. But we kicked her out, so we moved her with him.
I'm sure that was a fun conversation.
Yeah, she loves it. So she lives with him now, and now we've converted the whole house into a clinic. And so, yeah,
it's awesome.
It's lovely.
Well, thanks very much for your guys' time. Really appreciate it.
Thanks, guys.
Cheers.
Cheers.